Hi, my name is Tessa DeRosa. So welcome. Thank you for joining us today on how caregivers can support students return to learn. So here are some housekeeping rules that I just want to review with you. Please note that this presentation is being recorded. Therefore, it is not confidential and any questions or comments can be seen by all participants. The presentation is about 45 minutes long and we'll have 15 minutes to answer questions at the end. So during the presentation, you can put your questions in the chat box, or you can ask them live at the end of the presentation. We will try to answer as many questions as possible, but if we do not have time to answer your question, please do not hesitate to connect with your school to access the professional support services team. So every school, whether in person or virtually, has access to members of the psychological services team, social work, speech and language services, and often child and youth workers, counselors, and occupational and physiotherapists. We are here to support you and your families. We have also prepared a parent handout with the coping strategies and resources we refer to throughout the presentation. And I will include a live link to the handout in the chat box. Thank you.
Yeah, so like Tessa said, there will be a live link to the handout we'll refer to throughout the presentation, so you're welcome to access it during the presentation or afterwards. My name is Imola Marton, and I wanted to welcome you and thank you for coming to our talk entitled How Caregivers Can Support Students Return to Learn. The Professional Support Services team at the Toronto District School Board wants to support families as they return to school during an unprecedented time. Today, you're going to be hearing from myself, and I'm from the psychology department at TDSB, as well as my fellow colleagues, Tessa DeRosa and Norma Bram. So let's begin because we do have a full presentation. First, I wanted to start by acknowledging that 2020 has really been a memorable year, and for so many reasons. And for each of us, it's really unfolded a little bit differently. But everyone has their own story. But for all of us, there's been significant changes, and no doubt that these changes can have an emotional impact. So today, we would like to talk with you about the ways of taking care of ourselves and our families. We will discuss strategies and resources that might be helpful for you and for your children or your teenagers. Families everywhere are adapting to the many changes and challenges in our day-to-day life as a result of the pandemic. Many parents and caregivers are faced with trying to keep children occupied, support schoolwork, work from home, while others may have lost jobs. None of this is easy. Although our experiences have been different, undoubtedly, it has been a stressful time for almost everyone. Everyone reacts differently to stressful situations. Our response to the pandemic depends on many different factors, such as our previous life experiences, environmental factors, our community, and the amount of available support. It's important to remember that there's no right or wrong reactions to a stressful event, and that all of our responses are valid. Stress can show up in many different forms. You may have experienced feelings of anxiety, anger, frustration, fatigue, irritability, as well as physical symptoms.
Stress is a word we are all familiar with, and we often think of it in a negative way. For example, we often say, I'm too stressed to sleep, or my children are stressing me out. But stress isn't always negative. We actually need some stress to perform well in life. For instance, having some stress during a job interview or while preparing for an important event makes us more alert and efficient, which helps us perform better. Also, now that we are in the midst of a pandemic, being worried sometimes actually helps us to be safe by encouraging us to wash our hands, wear masks, and keep a safe distance from others. So having stress sometimes, or being in the green zone on this chart, helps us perform at our best and be safer in life. The trouble is, if we feel too much stress for a long time, so you're in the red zone on the right side of the chart, it isn't good for our health. It's hard to focus, to be patient, to be present, to parent and be emotionally available for our children. Basically, the idea is to be at the right level of stress to function optimally when needed, and then be able to return to a calmer and more relaxed state. We know that a child's well-being is highly dependent on a caregiver's well-being. The outcomes for children are more positive when they have at least one supportive adult who is able to provide a calm, predictable, and nurturing environment. So during times of increased stress, it is especially important to invest in your own well-being so that you will be in a better position to care for your loved ones.
In the next section, we will talk about some of the ways that we can take care of our bodies and minds. This will look different depending on what you like to do. For example, if you like to exercise, go for a walk, or do yoga. Research shows that getting outside and being active, eating healthy, and getting good sleep and maintaining a daily schedule are important contributors to well-being. First, let's review some of the simple things that we can do to get good quality sleep. First, our bodies like a routine, so it's best to try to go to bed and wake up at the same time as much as possible. To promote good sleep hygiene, it's best to keep our bedrooms free of electronics. And because the blue light delays the feeling of fatigue, it's a good idea to turn screens off 1 to 2 hours before bedtime. You may even want to consider turning the blue light setting down on your devices. Avoiding coffee 6 hours before bedtime promotes better sleep. Similarly, too much alcohol or other substances can interfere with sleep and does not allow us to cope with our stress with a clear mind. Finally, try to establish and maintain daily routines, such as getting dressed for the day, even if you're not leaving the house. Having a regular schedule provides a sense of control, predictability, calm, and well-being. Taking care of our minds is an important part of taking care of ourselves. So what are some ways that we can take care of our minds? Well, we can engage in activities that make us feel good, whether it's exercise, reading, or going for a walk. These activities not only make us feel good, but they may also divert our attention away from things that we may be worried about. We can limit our exposure to negative news coverage. We can connect with people we enjoy spending time with, such as friends, family, religious leaders, and school staff. We can practice gratitude, which involves thinking of things we're grateful for in times of stress. We can practice forgiveness and self-compassion. This involves having realistic expectations and being kind to ourselves. For example, allowing ourselves to take a break when needed, or forgiving ourselves when we make a mistake. We can practice positive self-talk and have hope as a way to maintain a positive outlook for ourselves and for our children. We can focus on the parts of our lives that we can control. We can identify calming strategies that work for us, such as mindfulness, deep breathing, visualization, and progressive muscle relaxation. Because taking care of our minds is so important for our functioning, let's spend some time talking about some of the strategies. Norma will start us off by talking about the importance of connecting with others.
Look at this comic. Probably all of us have answered this way before. When someone asks how we're doing, sometimes it's just easier to say, fine, than to actually take the time to talk about how we are truly feeling. But taking the time to process and express both our pleasant and unpleasant feelings with people in our lives who are supportive is important for our mental health and well-being. Research shows that when we express our thoughts and feelings, we can release some tension, which provides us with relief. Also, others can sometimes help us see things in a different way or provide a more positive perspective. So processing our feelings results in self-growth, deeper relationships, better decision-making, and puts us in a better headspace to parent and complete our jobs.
Norma, Your mic is a little bit weird. I'm not sure if others can hear you well.
No,
I wonder, is there anything you can do to adjust it?
I don't know.
Okay, that's a little bit better actually where you are now, I
Is it?
think. Yes, yes.
Okay,
Maybe you're closer to the speaker. Okay,
maybe.
try
Sorry.
that. That's okay,
Okay,
no problem. Hopefully people can hear you. Here's the next
thank you.
slide.
Thank you. Another way to improve our well-being is to practice gratitude. Gratitude is appreciating or being grateful for the good things in our lives. When we focus on positive things, we tend to be happier and feel better. One way to practice gratitude when we feel worried or sad is to write down 3 things that we are grateful for. We can also express gratitude by being kind to others or thanking someone for something they did. Showing gratitude in this way makes us and the other person feel better, and it also strengthens relationships.
It is also important to practice forgiveness and self-compassion. These are really challenging times we're in. So be kind to yourself and allow yourself to feel what you feel. It makes sense to feel stressed, worried, angry, or sad during this time. We've never experienced something like this before. Sit with your feelings. We don't always need to rush to get rid of these feelings right away. Self-soothe in the best way you know how. We will introduce you to a few calming strategies in a few minutes. Everyone's struggle is different, and the strategies that work for everyone are also different. And finally, if it feels like too much, reach out for help. Self-talk is a technique we can use to help manage our feelings. We are surrounded by all kinds of worried, negative, and critical thoughts, and sometimes we're our own worst critic. Over time, negative thoughts can result in us feeling anxious or sad. Research shows that people who think more positively cope better with stress, are more confident, have more social connections, are happier, experience greater life satisfaction, and improved immune function. So, how do we practice positive self-talk? The first step is to notice when the things we say to ourselves are not helpful and to replace those negative thoughts with more positive thoughts. So, for example, instead of saying, I can't manage all this stress, say, I have overcome other obstacles before. Or instead of saying, I'm a bad parent, say, I made a poor choice in parenting today, but tomorrow I will try to do better. Or instead of saying, I give up, I'll never be able to do this, say, this is really hard, but I'm going to keep trying. Be aware of when you have negative thoughts and try to replace them with more positive ways of thinking.
As Imola highlighted regarding self-talk, our thoughts are closely related to our feelings. Positive self-talk can be a powerful strategy, whereby if we change our thoughts about a situation, we can change how we feel about it. For example, when you think about your child returning to school and are overwhelmed by the thought, my child will get sick, you are likely to feel worried or anxious. However, if instead you think the schools are taking precautions to keep my child safe, or you think about the benefits of your child returning to school, such as my child will have a school routine again, you are likely to feel less worried. So you see, there is a clear connection between how we think about things and the way we feel. Now we would like to take a few minutes to talk about one way to reduce our stress level, especially when there is so much change going on in our lives. A big source of our stress comes from uncertainty or not knowing what the future holds. Throughout this pandemic, there has definitely been a lot of uncertainty. We tend to feel better when our lives are predictable, and we all like the feeling of being in control. Not surprisingly, research shows that when we shift our focus to what we can control, we see meaningful and lasting differences in our well-being, health, and performance. Let's think about those parts of your life you feel you have some control over versus the ones that you don't. Looking at this diagram, we see that someone might feel that while they cannot control things like how long the pandemic will last, whether schools will be open or closed, and other people's health, they may feel as though they do have control over some important aspects of their life, even during this difficult time. For example, they can limit their news intake, choose fun ways to spend their time, maintain social connections, choose to adopt a positive outlook, and to follow public health recommendations. So the take-home message here, think about all that is within your control, and when you're feeling stressed, it can be very helpful to shift your focus to the parts of your life that you can control.
Another thing we have control over is our choice to use calming strategies. Next, we will review a few of those strategies. Being mindful means paying attention to what's happening in the present moment in your mind, body, or your environment. It is focusing on the sounds, sights, smells, and the way our body is feeling. Paying attention to the present moment helps focus or ground us when we may be worried about past events or something that may happen in the future. Mindfulness has been shown to have positive impacts physiologically, psychologically, and emotionally. Let's now watch a video about what it means to be mindful.
You may have heard this word mindfulness. It's become something of a buzz phrase of late. I'm going to give you one simple, serviceable definition, which is this. Mindfulness is the ability to know what's happening in your head at any given moment without getting carried away by it. Imagine how useful this could be. Just as an example, you're driving down the road and somebody cuts you off in traffic. How do you normally react? I think most of us, we normally react by having a thought, which is, I'm pissed. And then what happens next? You immediately, habitually, reflexively inhabit that thought. You actually become pissed. There's no buffer between the stimulus and your reaction. With just a little bit of mindfulness, in that same situation, you might notice my chest is buzzing, my ears are turning red, I'm having a starburst of self-righteous thoughts, I'm getting angry. But you don't necessarily have to act on it and chase that person down the road, screaming at them with your kids in the back of the car thinking you've gone nuts. Now, you might be thinking, don't I need to get angry sometimes? Aren't I justified? I would say yes, but probably not as much as you think. The proposition here is not that you should be rendered by mindfulness into some lifeless, non-judgmental blob. The proposition is that you should learn how to respond wisely to things that happen to you, rather than just reacting blindly. And that, my friends, is a superpower. How do you get it? The way to get it is through meditation. I believe that meditation and mindfulness are the next big public health revolution. In the 1940s, if you told somebody you were going running, they would have said, who's chasing you? But then what happened next? The scientists swooped in, they showed that physical exercise is really good for you, and now all of us do it, and if we don't, we feel guilty about it. And that's where I think we're headed with mindfulness and meditation. It's going to join the pantheon of no-brainers like brushing your teeth, eating well, and taking the meds your doctor prescribes for you. Let me just close by saying, mindfulness is not going to solve all of your problems. It's not going to render your life a nonstop parade of unicorns and rainbows. Nonetheless, this is a superpower, and one that is accessible by you immediately.
In the handout that Tessa posted, you can access online. You will see some useful apps and websites, and some of these are for mindfulness specifically, and they can help those of you who would like to get started in mindfulness practice. There are also many others online.
Deep breathing is another calming strategy that we can use. You can practice deep breathing while sitting or lying down, or in other positions that are comfortable for you. When we get upset, we tend to start taking shallow and quick breaths, which intensifies our emotions. One really good way to calm our emotions is to slow down our breathing. Slowing our breathing triggers a relaxation response in the brain and body. Deep breathing exercises can be beneficial when you feel stressed, but they are most beneficial when practiced daily. The details about how to do deep breathing exercises are included in your handout.
Visualization is another technique that many people find helpful in managing their stress. It involves envisioning a place you find relaxing, whether it's being on a sandy beach, the forest, or even in a room in your home. Think about how it looks, feels, smells, and sounds. The more detail, the better. When you're feeling stressed, close your eyes and spend a few minutes imagining that scene. There are many visualization exercises available online. Another technique you might find helpful in reducing your stress is called progressive muscle relaxation. Stress can cause us to tense our muscles, and the more tense we feel, the more stressed we become. Progressive muscle relaxation is a technique that can help us become more aware of tension in our bodies. In this technique, we start by tensing and relaxing each muscle group, moving from our head down to our toes. At the end of the exercise, all of our muscles should feel more relaxed. Letting go of tension in our body can be a simple way to let go of our stress. A detailed example of how to do progressive muscle relaxation is included in the handout accompanying this presentation.
So the strategies that we've just discussed can also be used to support our children as they return to school. Each child will have a unique reaction to the pandemic and to returning to school, and they may have mixed emotions. Some children and youth, for example, may be excited to see their friends again, but may also be worried about their health or the health of their loved ones. Check in with your child about their thoughts and feelings about being back in school, especially if they exhibit changes in their behavior. Try to make yourself available. Watch for clues indicating that they may want to talk. Let their questions guide you. Be patient, honest, and accurate, but don't offer unnecessary facts or details. Remain calm and reassuring. Children will react and follow your reactions. Review and model basic hygiene and safety practices for protection. If your child is worried about their safety, help them feel a sense of control over certain aspects of their lives. For example, they can make sure to do a good job when washing their hands, wearing face masks, or practicing physical distancing. It's always a good idea to stay connected with school personnel. Ongoing communication and collaboration is key. Children will need time to readjust to a new normal. At school, we recognize that initially, emotional well-being is the priority over academics. Only once children get comfortable with changes and new routines will they be ready to learn.
Let's now spend a little bit of time talking about how we can support our children in talking about their feelings. Allowing our children to talk about their feelings has many benefits. In the short term, it increases cooperation and reduces emotional outbursts. In the long term, it teaches children to understand and manage their feelings in a healthy way and helps them cope with stress. So what is the best way to talk to our children about the feelings? One effective approach is the 5-step model. In this model, first, we want to attend to our child's emotional cues. Some of their cues are obvious, for example, if they're yelling or crying, and some are more subtle, for example, tension in their body or avoiding eye contact. As caregivers, you know your child best, so you're in a really good position to tell when they're upset. Next, we want to label our child's feelings. We want to put into words the emotional label that we believe corresponds to our child's emotional experience. So for example, if your child says, "I hate you," in a loud voice and tense body, you might say, "Wow, you're really angry with me right now." Or if your child has a somber and expressionless face, you could say, "I've noticed you've been really quiet this afternoon. I'm thinking that maybe you're feeling sad." When you're unsure of your child's feelings, it's a good idea to take an educated guess about how you think they feel. Often children, youth, and even teens and adults may struggle to think of possible feeling words. So we have provided you with this visual here that's also is in our accompanying handout that you can use if you need help talking to kids about how they feel. Next, we want to validate our child's feelings by conveying that we understand their experience. This is a really critical step. So when our children are upset, it makes us feel uncomfortable, and we often want to immediately fix the problem to make them feel better by providing reassurance or solutions. We often do this by using the word but. So for example, we may say, "I can understand that you may feel anxious about returning to school, but you need to get back to learning." To be more validating, replace "but" with "because" and offer an explanation that shows your understanding of their emotional experience. So your response could be, "I understand you're worried about returning to school because you've been away from school for a long time and because you're worried about getting sick." Next, we want to meet their emotional need. So if our kids are feeling sad, we can provide comfort and soothing. If they're feeling worried, we can help them to approach the situation that causes them distress. If they're angry, we can let them voice their anger and give them space. Once we label, validate, and meet our child's emotional need, we may help them think of practical solutions. And this is when we can engage in the last step, which is joint problem solving. So this step involves taking action if needed by making a plan with your child. So for example, if your child feels worried about being in public places during COVID-19, you can help them generate ideas of how to feel safer, such as acquiring masks and hand sanitizer, and reviewing social distancing practices.
As everyone's emotional responses or feelings associated with returning to school will be different, so too will their behavioral responses. Mental health practitioners anticipate that many of our children may be experiencing increased stress associated with returning to school. Stress or anxiety may manifest itself in many different ways for children and teens, as it can for adults too. Next, we will discuss a few possible scenarios that may arise. We will also share a few strategies that may help us to support our children. We will talk about anxiety in general, school avoidance, non-compliance, pushing the boundaries, setting limits, lack of motivation and engagement, and cyberbullying.
The signs of anxiety can vary in children. So in this page, you will see some common signs of anxiety. So in younger children, you may have them returning into behaviors that they have previously outgrown, such as bedwetting, or you may see excessive crying or irritability. In older children or teens, you can also see excessive crying and irritability, and also worry, sadness, and fatigue. You can also see unhealthy eating or sleeping habits, such as eating or sleeping too much or too little. We can see more refusal to cooperate than usual or non-compliance. We can see physical symptoms, including butterflies in their tummies or many other physical symptoms. They can engage in reassurance seeking, like asking to make sure that everything is going to be okay. Difficulty with attention and concentration, avoidance of activities that they used to enjoy in the past, unexplained headaches or body pain. In older kids, we sometimes see self-harm, feeling of hopelessness, and thoughts about death, and also the use of alcohol, tobacco, or other drugs. Anxious people focus on the possibility that something bad will happen, and they try to avoid situations that make them worried. And as caregivers, we often let our children and teens escape an uncomfortable situation to make them feel better. By letting them avoid their fears instead of teaching them that they can manage, children continue to feel anxious when presented with the same situation. So, for example, if your child is afraid of dogs, and every time a leash dog approaches them, you cross the street to avoid it, your child will likely to continue to be afraid of dogs. So, how can we help our children and teens face their fears? Well, we can convey that we believe in their ability to face their fears and encourage them to do so. We can help them brainstorm ways that they can calm themselves when they feel worried. All of the strategies we discussed earlier, such as positive self talk, deep breathing, mindfulness, visualization, and progressive muscle relaxation, are also very helpful for children and teens. We can reward our child's accomplishments as they face their fears. As children face their fears, they will learn that they can tolerate the situation, and the worried feelings will decrease with practice. It is important to be aware of how our own worries and associated behaviors may impact our children. And finally, if caregivers are aware of situations ahead of time that may cause anxiety, it can be helpful to have an action plan. You might prepare a child for a new situation or experience by providing reasonable and appropriate information, reminding them of using calming strategies and positive self-talk, talk about potential problems that might arise, and different problem-solving options. Finally, people with anxiety benefit from having a routine and predictability because it gives them a sense of security. So if your child is anxious, try to give them warnings when there may be changes in the routines.
School avoidance can be a really stressful experience for a family, even when there isn't a global pandemic. Caregivers generally expect for their children to attend school and can become frustrated when their child isn't willing to go. It can leave caregivers wondering how to proceed. Talk to your child about their reasons for not wanting to attend. Usually, it's to avoid experiencing distressing feelings, fears related to social situations, performance, or separation from a loved one. In the current circumstances, the fears may relate to safety and fears about getting COVID-19 or transmitting it to others. As with other anxieties, caregivers can work toward understanding the underlying thoughts that contribute to the upsetting feelings. Help your child adjust their thoughts to practice more helpful ways of thinking. A graduated approach to returning to school may be helpful, starting with small increments of time and building up. For example, first you can take your child to spend time on the school playground, then have them spend a short amount of time in class, and gradually increase the time as they achieve success until they are able to attend a full day. When your child attends school, even for short periods, it would be important to praise and reward them, to encourage continued attendance. Make use of the relaxation and self-calming strategies we have already discussed, such as deep breathing and visualization. School personnel are available to help you to problem solve. Sometimes finding little jobs for children to do, such as helping the teacher before school, can make the transition easier. Also, when your child needs assistance while at school, there should be a plan about what to do and from whom they can access support. For example, it might be arranged that your child accesses specific fidget toys, can speak to a particular trusted adult, or can draw in a sketchbook. If you continue to be concerned, you can connect with the school administration to consider accessing services from school support staff. Children feel anxious or worried about returning to school can also present as irritable and non-compliant. Keep an open dialogue with your child about their feelings, trying to attend to and validate their feelings as we discussed earlier. As much as possible, try to find time each day to give children their daily dose of positive attention. For example, by allowing them to choose their favorite game to play with you or going for a walk together. When you attend to their positive behaviors and reinforce them with praise, they will be more likely to repeat these behaviors. For example, you might say, "I like the way you put your clothes in the hamper when I asked." Even though it can be very difficult, especially after a long day, it's important to let some things go and just ignore some minor inappropriate behaviors, such as whining and tantrums. This can help to prevent power struggles and non-compliance. You may notice that compliance is often improved when children are offered choices. And that's because we all like to feel as though we have some control. It is also worth noting that the way we present our expectations to our child may influence how well they meet them. We know that giving short and specific statements instead of questions is much more effective. For example, "Please clear the table" is much more likely to result in the desired response than, "Do you mind clearing the table, please?" Also, some of us work better when there is a desired outcome waiting for us. So using when, then statements can increase compliance. For instance, try saying something like, "When you have cleaned up your room, then you can go and visit your friend." Similarly, reward systems can be used to reinforce behaviors. Children can work toward earning a mutually agreed upon reward for compliance. Non-compliance related to mask wearing and physical distancing during this pandemic reflects a new battle some families are facing. In particular, older children and teenagers may believe they are invincible. It is important to help them realize the impact their actions can have on others.
Being a caregiver isn't easy, and these times have been especially challenging. Many of us have been spending more time together as families than ever before. While this provides opportunities for bonding and strengthening relationships, it can also lead to more conflict and arguments. One issue that caregivers have described as particularly difficult relates to knowing how to set limits for their children. For example, imposing bedtimes or limits on the amount of technology or screen time children are allowed. Every family has their own rules. Caregivers may be worried about setting limits and upsetting their children during this difficult time. But rules and limits are important when they are consistent and fair. And this is because they help children to feel safe and healthy, especially in the areas of screen time, diet, exercise, and hygiene. Limits also teach self-discipline. By teaching our children rules and limits, they learn to be responsible for things such as homework, chores, being safe, and taking care of their health. Setting limits also provides opportunities to help our children manage their emotions. They need to deal with some uncomfortable feelings like anger, sadness, disappointment, and frustration, and you can support them through this process as they learn how to manage their emotions. Rules help children to feel that there is consistency and predictability in their lives, and that you as caregivers are taking care of them. Setting limits can be difficult, so let's talk about some strategies for effective limit setting. Research shows that children are most successful when raised by caregivers who have high standards and are responsive to their children's feelings. To set limits effectively, when giving directions, use a firm language but a warm tone. You want your children to feel emotionally connected to you. Be aware of your body language and facial expressions. For younger children, it can help if you get down to their eye level and get their attention. Make sure you have reasonable expectations for your child's developmental level. Teenagers need to have more independence than younger children. Also, it is unreasonable to expect children to always comply willingly. And when they don't comply willingly, it is a good time to use your emotional validation technique discussed earlier, which we called the 5-step model. It's always important to be fair, and generally, it's a good idea to be consistent but flexible, such as maybe allowing for later bedtime on weekends or on special occasions. Using praise and reinforcement when your child respects the limits you have set will encourage them to do it again and help to establish a pattern of behavior. This pandemic has been hard on all of us. Figure out what rules are important for your family. It might be time to let little things go and pick your battles. While some children may welcome doing schoolwork, others may struggle to re-engage after being away from completing schoolwork for some time, especially if school was hard for them. In the next section, we will explore ways to address weak motivation and school engagement. First, we want to explore the possible reasons for weak motivation or disengagement. For example, is the work too difficult? Is there a lack of interest in the subject? Or is the student finding it hard to re-engage after being away from school? Once we know the reasons for weak motivation, we can try to intervene accordingly. For example, if the work is too difficult, we can problem solve ways to provide additional support. This can include assisting with challenging homework assignments or breaking large assignments into smaller and more manageable parts. If the student lacks interest in the subject or topic, we first want to normalize that it's okay not to be interested in everything. We also want to see if there's a way to incorporate an area of interest into the work to encourage engagement. It is important to respond to our children in a warm, caring, and respectful manner to help them feel understood and supported. It is also important to have high standards by establishing clear academic expectations and routines, such as completing homework, and have fair rules and consequences. Caregiver praise and rewards increase academic engagement. Thus, it is important for us to praise our children when they complete assignments, put forth good effort, and express an interest in school activities. Set a time and appropriate place for completing homework, have clear expectations, and check to make sure all assignments are completed and submitted on time. Flexibility is important too. Children should have some say in their learning, for example, by helping to create their own schedules or choosing to work on topics of their interest where possible. Emphasize effort and persistence more than grades. Because we all have our areas of strengths and needs, it's important for caregivers to praise children when they work hard, regardless of the grades they earned. Comparing oneself to others can be discouraging. Instead, encourage your child to focus on their own gains. Have your child think about how much have I improved rather than how am I doing compared to everyone else. If you continue to have concerns, connect with the school in order to work together to better understand and solve the problem.
Children are spending more time online as a result of the pandemic. Therefore, caregivers need to be aware of cyberbullying and how to manage it. Many children fear telling their caregivers about being bullied online because they feel ashamed or embarrassed, or they fear that it will make the situation worse. Victims of cyberbullying show many of the same signs as victims of other forms of bullying, such as acting withdrawn or sad, refusing to go to school, and struggling with schoolwork. Children may also show a change in their pattern of online communication, such as completely avoiding it or checking their messages and accounts more frequently. Here are some tips for how to support your child if they experience cyberbullying. Reassure your child that their safety and emotional well-being are important to you. Remain calm to help gather all the information, even though this can be upsetting. Continue to allow online communications. Removing online access could isolate them from supportive peers. Instead, it would be important to increase your monitoring to protect your child. Consider talking to the caregivers of other children who may be involved to explore possible solutions together. If there are threats involved and your child feels unsafe, Or if the bullying involves criminal activity, notify the school, or if necessary, go to the police. Some other suggestions for dealing with cyberbullying are: tell your child not to respond to any of the bully's messages, posts, or emails. Bullies are often looking for a reaction from others. Block the bully by setting social media sites to stop their messages and prevent bullies from having access to what your child posts. Report the bully online. Cyberbullying violates the conditions of most social media sites, and most websites have easy and anonymous ways of reporting it. It is also a good idea to keep all communication as evidence. For example, print out all messages, pictures, and take screenshots whenever possible. Sometimes our anger, worry, and sadness can be too much to handle on our own. Often, caregivers wonder when to reach out for help for themselves or anyone in their family. You may want to think about reaching out for help when these statements are true for yourself or someone in your family. Anger, worry, and sadness can be a problem when someone feels this way almost every day, feels overwhelmed and very upset, stops doing fun and important things, has changes in sleeping and or eating habits, uses alcohol or drugs and or other problematic strategies to avoid feelings, or has problems with relationships.
There are many professionals available. There are many professionals available who have experience working with children and teens. You may consider reaching out to your school guidance counselor or teacher. Also, every school has an assigned psychology staff, social worker, and often a child and youth worker or child and youth counselor. You can ask your guidance counselor or school administrator about getting a referral for their services. Other supports available in your community include your family doctor or community counselor.
Reach out to others and know that there are professionals available to help. Here are a few community organizations, which are also included in your handout. Here are some helpful websites and free apps to consider. The apps are all strategies to manage anxiety. All of these resources are included in your handout.
Even though we have all had different experiences throughout this pandemic, we're all faced with the same task of supporting our children's return to school to a school year that looks very different from previous years. While this can be very stressful, we hope that we've shared a few useful strategies for you or your family. As caregivers, by taking care of ourselves, we can give our children the attention, support, and affection that they need now more than ever. We wanted to thank you for taking the time to join us in our presentation today, and we welcome questions at this point if you have any. Tessa, was there anything in the chat that we could address?
No, there were no questions in the chat as of yet.
Okay. And if there are questions now, can people unmute their mics, or is that not? Oh, they can?
They can unmute their mics, or I can.
Okay. So if there are any questions.
You're muted. What happened? I don't know. You're muted. Yeah.
Okay. I was just saying, if there are any questions, we have a smaller group today and we're happy to answer questions if people have some from the audience.
We have a quiet bunch.
We do. In the chat, you will find the link to the parent resources that we have put together for you. It is an active link, so you can open it and you're welcome to save it and refer to it later. There are instructions there about how to do the progressive muscle relaxation, and there are many mindfulness and apps to manage anxiety there that are very helpful, that could be used for kids as well as adults. Um,
Oh, the link is to a Zoom conference. That's funny. Okay, just a minute. I did copy it from, but I'll double check.
Thank you for letting us know.
Yes, thank you.
We will definitely, Tessa,
Yeah.
our techie, will get the link to you. On the link, you will see a lot of some of the important slides that we had up during the presentation. So there is a slide about, for example, talking to your children about their feelings. Sometimes we find that using the feelings emojis, or there are other ones online other than emojis too, helps kids talk about their feelings. So we often use that with the kids when we're working with them. Some kids have difficulty identifying the feelings, and this helps them to do that. Is that it, Tessa?
Yeah, it should be. I clicked on it. It's just taking a minute to load, but it should be the
Okay, so you're
correct link.
are you opening it, Tessa, to check and see if it's the one that we wanted?
I am. I did open it. It's slow, but it is the copy of the caregiver handout.
Okay, so that's good. So we have that handout there. We have the progressive muscle relaxation. We didn't have time today to do, we did have a visualization exercise that's included in our webinar that we posted that can be accessed on the TDSB website. But there are many others online if that's something that people are interested in.
So you can actually copy the link that I sent and paste it in another document to open it as well.
Okay, that's good to know. You could also probably save it, right, Tessa?
Yes, on the chat. You can save the chat.
And maybe I can open it right now. You can see it, right?
Yeah.
Okay, so here is the handout that we're talking about. These are just the topics that are covered there.
So
here you will.
You're not sharing though.
Oh, I'm not sharing. Okay. Because I have to open it as well.
Yeah.
Okay, here we go. Okay, now you can see it?
Yes.
Okay, so here's the handout that we're talking about. And here are the community supports that we refer to. And here are the apps that we had discussed that are helpful. And these apps right here are all to manage anxiety. And there's some mindfulness ones, and you might find other ones that you like. This is how you know when to reach out for support. And here's the progressive muscle relaxation if anyone's interested, and the deep breathing and the steps to do that. Just some important reminders. And the COVID-19 age-appropriate explanations we didn't cover here, but there are essentially ways of talking to your kids about COVID-19 that are broken down by developmental level. So that's helpful. And the common symptoms of anxiety and improving sleep. And here's what I was talking about earlier about if you wanted to have a reference for talking to kids about their feelings, and if they're having trouble identifying the feelings, a chart like this is often helpful. And just a reminder here of the 5-step model. Okay, do we have any questions now, Tessa?
No. No questions. No
Okay,
questions.
must have been a straightforward presentation.
Yes. So I guess if we don't have any questions, I guess we can end the presentation.
Okay.
So thank you so much for joining, everyone.
Thank you so much for joining us today. And if you have any other questions, just know.
Oops, we got a question. Yeah.
Okay.
My daughter often gets angry when she can't figure out her homework. Unsure what I can do to help. So the
Yeah,
validation would be key.
yeah, I agree. So first validating, that I understand that you're frustrated right now, and just talking about what it is that's frustrating for her, and some of those things that we talked about earlier. So is it that trying to figure out what's the cause of the frustration? So is it that the work is difficult for her? Is it that sometimes kids are tired, and it could be something as simple as that. So is it fatigue? Is it that the work is difficult for her? Is it that it's a subject that she doesn't enjoy doing, and so it's really difficult for her to get engaged? Um, so I would start with trying to figure out what's in the way, what's getting in the way of her enjoyment of doing that particular assignment. Sometimes it can be a particular topic as well. So some kids, if they're finding math difficult, for example, then they're finding it hard to get engaged. So then we sort of meet the needs. So if she's having difficulty, then scaffolding the work. So working with her to understand the question. I wonder if we could have a little bit more information about it.
It may also help to do certain components of the homework at different times. So depending on, if I don't know if she's in school or virtually, you may, break up the homework in smaller chunks so that it's not as overwhelming. First, she does, or a first set of questions, and then she gets, to spend time doing something she enjoys, and then you could repeat that pattern.
Yeah, I'm just reading the chat again because
Yeah. Okay.
yes, she gets angry. So yeah, so the participant is saying she's a bit behind in her class. She gets angry during virtual class time. We are trying to help her after school because she gets angry during class. So yeah, we often see this in kids who are a little bit behind. So oftentimes they feel like they're working harder than the average child to make up the effort. And so when they're working hard, it can be and the result is not the same. Then frustration is a common thing that we see. So I agree with Tessa, sort of breaking it down a little bit and helping, maybe even doing it in smaller chunks, and even having a reward at the end. And like, I guess, conveying that you understand that their frustration, that you're so proud of them, that they're working hard because you know that it's hard for her, and that we're going to finish this small chunk today, and then we're going to do something enjoyable. So whether it's playing a game together that she really enjoys, or having a special snack. Yeah, it's a difficult thing when kids are struggling because, sorry, Tessa.
Yeah, it may also help to start off with something very easy, so that she can be successful, and that will help propel her to want to work on work that may be a little more difficult for her. So you can speak to the classroom teacher to see if you can, or you can design, activities where she will be very successful, and then you can move on to items that may be a little harder for her or difficult.
I wonder if too, connecting with the teacher, and you might have already done that, to connect with the teacher and have a dialogue with her about the appropriate level of the work. So typically we want kids to be working on work that is slightly above their level of ability, but not much above, because then they get really discouraged. So and teachers, I find often, if they know that the student is behind or is having difficulty and is frustrated, then they sometimes will be able to adjust the work. And now I see there's a comment.
Yeah, it is very challenging with a split class.
Yeah, split classes are difficult.
With that being said, the focus
But even,
still needs to be on, providing appropriate material for your daughter where she can feel successful.
Right. I agree. So even in split classes, it does make it more difficult for teachers, but accommodations can still be made, I think. And, um, I think it always depends a little bit on the teacher in these cases, but it's nice when the teachers are flexible and understanding. And it is, as things change, I would encourage you to keep an open dialogue with the teacher. So you want to sort of monitor, is she getting more frustrated? Um, then it might be worth revisiting with the teacher again what can be done, because if she doesn't have a positive experience in her learning, then it'll be more difficult for her to acquire the skills needed. That was a good question.
Yes, no, thank you for
Mm.
putting that out there. Again, you can also, practice some of the coping strategies that we put into place so that she can
Mhm.
start to, manage her frustration and, know that she is in control of her frustration in terms of dealing with work that may be difficult for her.
Mhm. Yeah, and I'm just rereading the comment too. You were saying that she gets angry when she can't figure out the homework.
Mm-hmm.
In addition to the validation, you might want to do some deep breathing with her when she does get upset, just as a way to calm down. And usually, while it's not going to solve her frustration necessarily with the work being difficult for her, it might help to sort of to reset her a little bit to the work. Sometimes also reminding kids, that of things that they're good at, or that with support, that you're there to support her, and that by working together, that you will figure it out, is helpful.
Yeah, and just to step away from it,
Hmm.
initially and then revisit. I mean, that often happens with us sometimes. You can't figure out a question and then you take a break, you go back and it seems a little clearer.
Hmm.
So,
Right.
so I hope that, yeah, I hope that all works out for you.
Hmm. Yeah, it's hard to know what to do sometimes when our kids are upset, um, and um, certainly it can be challenging. But I think first and foremost, just being patient and calm and validating that you understand that it's difficult for them, um, means a lot to kids. And I think we sometimes don't realize that that's kind of the most important thing that they need from us as parents. Okay. Do we have any other questions from the audience today?
I think that's it.
That's it. What do we do now? Do we?
Yeah, I think we end.
Okay.
Thank you.
Thank you, everybody, for joining us today for the presentation. And
Yes,
we
I'm
wish
wishing
you,
everyone well. Yeah.
yes, and a nice rest of the weekend. Take good care. Bye, everybody.